Good morning everyone. Myself Sanjita Pandit. Welcome back to channel Medical with Sanju. आजको क्वेशन रहेको छ हाम्रो Eclampsia and Pre Eclampsia during pregnancy. Question number 471. Multi-system disorder of unknown etiology characterized by hypertension 140/90 mm of Ag or above with proteinuria after 20th week of pregnancy is called. Option A gestational hypertension, option B preeclampsia, option C eclampsia, and option D chronic hypertension with pregnancy. This condition is known as a preeclampsia. Option B is right answer. Question number 472. Which of the below is true with regard to pregnancy-induced hypertension? Option A. Visual disturbance are always present. Option B. Proteinuria is usually present. Option C. It is also called as gestational hypertension. And option D. There is raised BP before 20 weeks of gestation. It is also called as gestational hypertension. Option C is right answer. Question number 473. Pregnancy-induced hypertension usually develop into mother after option A 18 weeks, option B 20 weeks, option C 22 weeks, and option D 16 weeks. Pregnancy-induced hypertensionलाई preeclampsia पनि भन्छ and it is also called the multi-system disorder र यो 20 weeks of the pregnancy पछि चाहिँ start हुन्छ. Option B is right answer. Question number 474. Preeclampsia is more common after 20 weeks of pregnancy in mother with option A normotensive, option B non-protein urine, option C hydatidiform mole, and option D A and B. Option D A and B is right answer. Question number 475. The danger of convulsion in a woman with preeclampsia ends. Option A after labor beings, option B after delivery occurs, option C 24 hours postpartum, and option D 48 hours postpartum. The danger of convulsion in a woman with preeclampsia ends after 48 hours postpartum. Option D is right answer. Question number 476. Development of hypertension with edema and proteinuria are both during pregnancy called option A essential hypertension, option B hypertension, option C gestational hypertension, and option D preeclampsia. This condition is called preeclampsia. Preeclampsia मा तीनवटा चाहिँ मेन हुन्छ hypertension, proteinuria and edema. Hypertension, proteinuria and edema भयो भने चाहिँ preeclampsia हुन्छ र यही कन्डिसनमा यदि कन्भल्सन पनि छ भने यो eclampsia हुन्छ. Question number 477. The yearly sign of preeclampsia is option A headache, option B polyuria, option C proteinuria, and option D seizure. Proteinuria. Option C is right answer. Question number 478. Which one of the following seen in preeclampsia? Option A proteinuria, option B weight loss, option C hypotension, and option D facial hair. First मा proteinuria हुन्छ. Option A is right answer. Question number 479. All the following are characteristics of preeclampsia except option A vomiting, option B hypertension, Option C, edema, and option D, proteinuria. Vomiting is not characteristic of a preeclampsia. Option A is right answer. Question number 480. A nurse is assessing a client with pregnancy-induced hypertension. The nurse expects the client's blood pressure to be option A 150 by 100 mmHg while standing and sitting. Option B elevated and accommodated by a headache. Option C above the baseline and fluctuating at each reading. And option D 30 by 50 mmHg over the baseline on two occasions 6 hours apart. Systolic blood pressure more than 30 mm of Hg and diastolic blood pressure more than 50 mm of Hg लेसाइ बढेको हुन्छ previous blood pressure मा. So option D is right answer. Question number 481. The mother's blood pressure climbs to 170 by 100 mm of Hg. Which of the following symptoms would suggest to the nurse that the patient may be about to convulse? Option A increased fetal movement. Option B decreased temperature. Option C epigastric pain. And option D urine output of 40 ml per hour. Right answer is option C epigastric pain. Question number 482. Which of these is an alarming sign of preeclampsia? Option A proteinuria of +2. Option B edema grade of +2. Option C blood pressure of 150 by 90. And option D deep tendon reflexes. Code flaws. Option D deep tendon reflexes is an alarming sign of preeclampsia. Question number 483. A pregnant woman is presenting to the OPD at 35 weeks of gestation with a severe facial and pedal edema. Her blood pressure is 160 by 110 mm of Hg. Proteinuria is 3 plus and serum creatinine is 1.8 mg per dl. She is complaining of headache, breathlessness, and epigastric pain. In which of the following categories would you classify her status? Option A gestational hypertension. Option B mild preeclampsia. Option C severe preeclampsia. And option D eclampsia. This condition is called severe preeclampsia. Option C is right answer. Severe preeclampsia मा severe proteinuria हुन्छ, blood pressure 160 by 110 हुन्छ र यसमा अदर पनि सिम्पटम्सहरू चाहिँ हुन्छ. मेन भनेको चाहिँ ब्लड प्रेसर 160 by 110 छ भने चाहिँ सिभियर प्रेक्लेम्सिया जान्छ. Question number 484. Charu is hospitalized for the treatment of severe preeclampsia. Which of the following represents an unusual finding for this condition? Option A generalized edema. Option B proteinuria 4 plus. Option C BP of 160 by 110 and option D convulsion. Unusual finding, that is convulsions. Question number 485. An antenatal mother admitted to the labor room with a blood pressure of 150 by 90 mm of Hg. Proteinuria 3 plus. Edema of the hand and face is diagnosed with severe preeclampsia. Which among the following clinical findings supports the diagnosis? Option A joint pain. Option B constipation. Option C vaginal bleeding. And option D visual disturbance. Visual disturbance is one of the characteristics of preeclampsia? Option D is right answer. Question number 486. Presence of preeclampsia is indicated by a serum uric acid level of more than option A 2 mg per dl, option B 3.5 mg per dl, option C 4.5 mg per dl, and option D 6 mg per dl. 4.5 mg per dl. Option D is right answer. Question number 487. Occurrence of seizure during pregnancy is termed as option A eclampsia, option B preeclampsia, option C epileptics, option D myoclonus. प्रीएक्लेम्सियाको क्यारेक्टरिस्टिक्समा प्लस सिजर गरिदियो भने एक्लेम्सिया हुन जान्छ. Preeclampsia when complicated with convulsion, generalized tonic-clonic seizure or coma is called eclampsia. Question number 488. The incidence of antenatal eclampsia is option A 20%, option B 30%, option C 50%, and option D 60%. The incidence of antepartum eclampsia is 50%, intrapartum eclampsia is 30%, and postpartum eclampsia is 20%. Option C is right answer. Question number 489. One of the important symptoms of assessment of a woman with eclampsia is option A weight gain, option B concentrated urine, option C hypertension, and option D feeling of fatigue. Hypertension. Option C is right answer. Question number 490. Eclampsia is characterized by the following except option A seizure, option B mild facial edema, option C BP more than 160 by 110 SC, option D marked proteinuria. Option B is right answer. Mild facial edema यो प्रिक्लेम्सियामा हुन्छ, त्यो पनि प्राइमरी प्रिक्लेम्सियामा. Next question in other video. Thank you so much.